For hormone replacement therapy, which is frankly speaking, the only effective aspect of primary care in this country, in Western medicine, the only thing that works is hormones. So if you are going to do that, please do that in the private setting. Do it with a doctor or someone who is knowledgeable, who does this day in and day out, and don't use it with insurance. Because remember, if you apply insurance and if you make the doctor send the prescription to CVS, that doctor is limited in what they can prescribe to you. Do you really want that progesterone to come from Teva and smells like has been stored for 1 million years and doesn't work anymore? Do you really want that? Like, doesn't your health matter to you? So once again, do you not, as a woman, do you not want the chance of being able to take oral testosterone instead of having to inject it? Because you know what? Compounding pharmacies make it in oil suspensions, in little things that you can take that are absorbed by the lymphatics, and it's very safe. So again, when it comes to your health, okay, it's important to think about price and money. We should always think about that. But also think of quality. And that's the part that people are missing. Managed care is selling you low quality for a high price. So if you're going to pay the high price, get good quality.